With the coronavirus lockdowns easing in many parts of Africa, what will it be like returning to work or to school? How do we keep ourselves healthy? And when might there be a vaccine? These are all very important questions that are top of mind for many. Hello and welcome. I'm Hayley Adams Fitzpatrick. Now, during this coronavirus outbreak, the Voice of America has been holding a series of virtual town halls with African healthcare professionals answering your questions in English, Portuguese, French, Swahili, Somali, and Amharic. And in the next half hour, we'll bring you some of those answers in a special edition of Our Voices. Joining me remotely are my co-hosts Oriane Itangishaka and Ayen Bion.
Thanks, Haiti. We'll hear today from the former health minister of Benin, Dr. Dorothy Okoko Kinde-Gazard. She'll be talking about the search for a vaccine and what public health officials have learned from the outbreak.
We'll also hear from Ethiopian-American Dr. Sosina Kabede about the risk of catching the virus from shared surfaces. And we'll hear from Hargeisa-based physician Faduma Hashi Iman about how people with high blood pressure are especially vulnerable.
Thank you, Oriane and Ayen. And you can also join the conversation on social media. Our handle is at VOA, Our Voices. You can also find us on WhatsApp. That number is right there on your screen. Do tell us how this pandemic is affecting your life. Also, if you have any other questions about the coronavirus, you can put them to us on social media. Let's get started.
For VOA Portuguese, Angolan singer Irina Vasconcelos recorded a public service announcement about coronavirus prevention.
Wearing the mask whenever you leave the house, social distancing, and avoiding physical contact, washing your hands whenever possible, and teleworking whenever possible are four of the measures not to be forgotten, as they can save lives, mine and yours.
Mozambican physician Graça Matsinhe explained why we must all take this virus seriously.
COVID-19 is a disease that presents a clinical condition very similar to the common flu that we have had mainly in the cold season. However, the difference between the coronavirus and the common flu is that the coronavirus can lead to quite severe respiratory infections, including pneumonia, and can even lead to death. There are some factors that make a person more or less susceptible to the disease, including older people. Elderly people are at increased risk of contracting this disease and even contracting more severe forms of this disease. But also people who have some underlying medical conditions. When I talk about underlying medical conditions, I mean any chronic illness, which becomes a factor that can also make a person susceptible to a serious coronavirus infection. I would say diabetes, hypertension, diseases that cause a weakness in the immune system, such as HIV/AIDS, among other diseases that can affect the immune system.
In a special co-production with VOA's affiliate, Ahadu TV, our Amharic colleague spoke with Dr. Sosina Kabede, who is an internist in the U.S. city of Baltimore. Dr. Kabede took question from Ikran Mubarak from the Ethiopian city of Dire Dawa.
When we ride in taxis, we touch the seats. Is it true that the virus is found on metal or it can be everywhere? Muslims prostrate ourselves during prayers on the same mat or carpet where other people have done the same thing. So, for how long can the virus stay on the carpet, or does it stay there at all?
It is a good question. The virus can stay for several minutes on metal, wood, and stone, as well as on different types of coverings and upholsteries. This is the reason why it is necessary to wipe and clean all surfaces and areas with solutions containing 75% or 60% alcohol. The virus also has different levels of endurance in different temperatures or heat conditions. It may stay for several hours, and some studies indicate it may stay even for days. So, when people go to pray, be it in mosques or churches, it is advisable that they clean the place where they pray with a solution containing alcohol.
Dr. Kabede explained what is known about coronavirus and pregnancy.
No study so far has concluded if the virus can be transmitted from a pregnant mother to the fetus. However, I read that there have been babies who tested positive for coronavirus a few hours after they were born. There is no proof when the infants contracted the virus, if it was in the womb, or during labor, or immediately after delivery. So, pregnant women are advised to take the same precautions as anybody else, but with some stricter measures. Since here another person has already been involved, the baby. Wash your hands for 20 seconds repeatedly. All items that are being used must be cleaned with a solution containing alcohol. Cover your mouth and nose. Avoid going to crowded places. Keep social distancing of 6 feet or 2 meters. It is essential to take these measures always. What is more, a small study conducted in Spain showed that if pregnant women with COVID-19 underwent surgery, the effect may be severe. So, unless there is another health complication, it is not advisable for a pregnant woman with COVID-19 to have surgery. If she has other issues and COVID-19, then she and her doctor should decide what is the best course. Another related question is whether coronavirus is found in the mother's milk during breastfeeding. There is no proof of coronavirus in breast milk, but even if it is found, breast milk will strengthen an infant's immune system, so mothers are always advised to breastfeed their newborns. Of course, if the mother has COVID at the time of birth, she may squeeze the milk from her breast, and others may help feed the baby until she recovers. However, since little is known about COVID-19, it is better for pregnant women and for those who have just given birth to take the precautions more seriously than non-pregnant ones. It is not known yet where and when the infants get the virus, inside the womb or during and after birth.
Well, we'll have to take a quick break. When we come back, we'll get answers for Africa's youth. We'll take a closer look how COVID-19 may affect them because they may not have symptoms. That's coming up next.
Before I had customers and used to receive fabric at the end of every month. But with the coronavirus, I do not have any more customers like before. I avoid big crowds, and I respect all the rules that the government implemented. No, I did not receive any help during the crisis. They came to take our names, but I didn't get anything. With the end of the lockdown, I can resume my work and have customers like I did before the crisis.
Being part of Our Voices is about more than just sitting here and talking about women's issues. It's about listening to them.
and bringing their opinions to the table and making sure their voices are heard.
Because our lived experiences, our stories, and our voices will help shape the next generation.
You're with Our Voices. Welcome back. On a special edition of VOA's Straight Talk Africa, my colleague Lenore Madu spoke to Columbia University Professor of Epidemiology, Karesha Abdul Karim. She's also from the Center for the AIDS Program of Research in South Africa. They spoke about how the coronavirus is affecting young people on the continent.
So what we know about COVID-19 is that the majority of people who get infected are largely asymptomatic, so about 80%. And then you have a small proportion who present with some mild symptoms, and a much smaller proportion who present with severe disease and require hospitalization. And it's absolutely correct. With children, the majority, I would say more than 99%, present asymptomatic or with very mild symptoms. Now, what we see in terms of deaths, both in Africa and outside Africa, is that it tends to be higher amongst people who are older, over 60, but also we're seeing people like in their 30s and 40s, if they have comorbidities or chronic conditions that we see more likely hospital admissions and also more deaths than we've seen in other countries. In Africa, we're typically dealing with a much younger population. About 65% of our population is under 35. But we also have a concomitant epidemic of TB and HIV. So it's going to be very interesting. Other countries that have seen the epidemic peak and seen declines have not had the TB, HIV epidemics that we have. So this combination of non-communicable diseases with our high burden of communicable diseases, it's going to be very interesting to see how things unfold in Africa because of these unique configurations demographically and also in terms of disease burden patterns.
Professor Karim also spoke about how women who are sick and have to stay home can help protect the people they live with.
Yeah, this is a very important issue, as I mentioned earlier, about the living conditions for many people in Africa is quite constrained in terms of a number of people within a household and also where we have women who are the main healthcare providers on the continent, in addition to being first responders. So beyond healthcare work, things like cashiers at supermarkets and shopping malls and so on. And this has caused immense challenges and is very troubling for women who have families, and when they come back, will they be infecting them and so on. So one of the calls, which is, can there be other isolation facilities? And it may sound like a bit of a luxury, but I think in homes where many people and the possibility of self-isolation is not possible, I think government interventions for those facilities are important. But at the end of the day, I think the things we have in our hands is what we know, which is about frequent hand sanitizing the surfaces and environments we're living and working in. It's about the social distancing as far as it's possible. It's about the use of masks on a regular basis. And those things are things that will help us to minimize spread and not only protect ourselves, but protect people who are close and near to us in the workplace or at home.
Now, Professor Karim says there are lessons to learn from the outbreak about public health planning and protections for young women.
Africa has to lead some of the innovations in terms of diagnostic kits and tests, in terms of vaccines, in terms of new therapeutics, because all brand new, we're all learning, and this is the first opportunity we have to not just be recipients and imbibe what comes from somewhere else, but to actually be part of the solution. The second is that, as has been mentioned many times, that Africa has a very large informal sector. It's all women-headed and women-driven, and it's also young women. So we do need to look at some of the values we place on women in society. And I want to use again a South African example where gender-based violence has skyrocketed. And we really need to use the opportunity as we're dealing with COVID-19 to address that. And I'd say, lastly, we have a lot more agency than I think we give ourselves credit for.
Well, we're going to take a short break here, and when we come back, we answer questions about a coronavirus vaccine, when and if one will become available. We'll have all that for you after the break.
The damage is tremendous, and it has a domino effect. You see, I am a restaurant owner. I employ people, and these people rely on the income that comes from my restaurant. So suddenly it all stopped. Everything related to it too. The purchases, the contacts, the deliveries. It's like a chain. It all goes down too. It also has an impact there. So the damage is really huge. I can say without exaggerating that it created a sense of misery. We have not received any help from the government. I wonder if we ever will. During their decision-making, they did not take us into consideration. If they want to help, they need to be organized. And we weren't even considered, although we pay our taxes. On what basis will they compensate or help? So no, I have not been compensated, and I will not be compensated. In the transportation sector, contamination happens very, very, very fast. They let them work while taking precautionary measures. But they did not do so for catering. Catering is necessary. They could have organized us as well. Asked us, for example, to distance clients a meter apart. We also shouldn't limit ourselves to ways to stop the pandemic. What about afterward? If I open tomorrow, I will insist that my clients wash their hands when they enter and when they leave the restaurant. So that's how the pandemic affected us. The future rests in God's grace.
Like Voice of America on Facebook. Follow VOA on Twitter. Join VOA on our YouTube channel. Like, follow, join VOA.
You're with Our Voices. Welcome back. On VOA French television, the former health minister for Benin, Dr. Dorothy Akoko Kinde-Gazard, answered an audience question about vaccines.
Today, the world is talking about finding a COVID-19 vaccine. How long until they find a vaccine? And if they do find a vaccine, will we, the poor people, have access to it and be able to get it easily?
The vaccine will not be discovered tomorrow. It will take at least 12 to 24 months to have a vaccine if we are complying to all the vaccine development procedures. So it's in our best interest to focus our efforts in the control and prevention and insist on control and prevention. Would the vaccine be available in our country? Normally, the international community will have to make arrangements when the vaccine is on the market and will be available everywhere and accessible to everyone. I remember that in the 80s, with the HIV/AIDS pandemic, in the beginning we didn't have access to the treatment, and today treatment for HIV is free. And I think it will be the same for all pandemics of our century.
Dr. Kinde Gazard says African public health officials have learned a lot during this crisis.
We must be able to capitalize on the initiatives that have been taken all over Africa in regard to the manufacture of hand sanitizers, respirators, masks. I think these are all initiatives that we must capitalize on and say that we can manage these situations. We have a lot of intelligence that must be supported in order to help the development on our continent. We don't want to wait for the masks to come from China and realize that there are not enough for everyone.
Our VOA Somali colleagues spoke with Hargeisa-based physician Faduma Harshi Iman about how people with high blood pressure are especially vulnerable to coronavirus.
COVID-19 is a contagious virus, but high blood pressure is a disease that causes heart attack. Blood pressure weakens cells, and if someone with high blood pressure is infected with COVID, that makes that person weaker and puts them at higher risk. There is no direct connection, but people with high blood pressure have an increased risk of dying from COVID-19 as it attacks small cells and creates blood clots. They are the most vulnerable to COVID-19, and they are urged to be very vigilant and stay at home as much as they can. People with pre-existing medical conditions, such as diabetes, cancer, heart disease, appear to be also more vulnerable to becoming severely ill with the COVID-19 virus.
Dr. Iman says social distancing and healthy diets are a better bet against coronavirus than some popular herbal remedies.
Medicine can be effective when it's proven and approved by scientists. The herbal medicine that some people use is not based on scientific evidence. And because of COVID-19, I do not advise people to take herbal remedies for cure or prevention. There are no proven traditional remedies that can cure this virus. Even the developing countries cannot find, until now, a medicine to cure this virus. So without evidence, I could not tell people to use garlic or onion for treatment. Let us take the advice and guidance from health professionals. Let us enforce social distancing. Let us use masks. Let us eat healthy food that can boost our immune system.
Dr. Iman says the virus spread cannot be fully understood without proper tracing.
We have to first understand that COVID-19 exists and that it is a deadly virus. If people understand that, then they can take all the steps needed, including hand washing and social distancing. Secondly, we have to report all COVID-19 patients. But statistics say those infected with COVID-19 are hiding and are not coming forward as they are afraid to be quarantined. We have to listen to the health advice from doctors and local authorities. Also, we have to work with health organizations to contain the spread of the virus.
From the Democratic Republic of Congo, a provincial minister for social affairs, family and children, Fatima Hassan Shila, joined VOA Swahili program Duniani Leo. Our colleague Miriam Gawe took a question for her from an attorney in Goma.
Mimi ni mwanasheria I am a lawyer and I defend people in the court. We have prisoners and different customers. It has been 3 months now. We are not doing any work. They are telling us to stay at home and respect the guidelines for preventing coronavirus. We are wearing masks. We are staying at home. We can't go to work. How can we live? This virus has no vaccine. We are asking doctors, how can we live? If we are wearing masks and we practice social distancing, they should allow us to go to work because we will die for hunger in our houses and prisoners will die in jail. In Muzenze prison here in Goma, for example, there are coronavirus cases.
First, I want to start by saying since coronavirus started here in Goma, we didn't lock down the city. We have been telling people not to go outside if there's nothing important that they need. If you're going outside to just greet friends or walk around, no. You can go to work, but follow the health guidelines to protect yourself. We also have not closed offices or businesses, but we closed borders, so if someone is doing business, they can continue with their business. For the prisoners, they are being taken care of very well. Prisoners who have the virus are being separated and being taken care of well. The government has also been making sure that whoever we have to release from prison are being released while following the proper measures.
And that's where we'll leave it for this week. We hope you have found at least some of the answers that you're looking for. Thank you so much to my co-hosts, Oriani Tangishaka and Ayen Bio. Thank you also to our colleagues in VOA Somali, Swahili, French, Amharic, English, and Portuguese for sharing their interviews with us. And thank you very much for watching. We'll see you next time. Stay safe. Goodbye.